I first heard about Ambient Experience by someone who was in the position before I took on this role. It was a passion of his, and when he retired, he told me, you have to make sure that you get the Ambient Experience. And I didn't know what that meant. I just knew that there was a cost associated with it. So I learned more about it when the vendors actually came on site and showed it to me. And once I saw it visually, I agreed we absolutely needed to have it here.
So I learned of Ambient Experience when we were looking to purchase equipment for our new Golisano Children's Hospital, and we were looking to create an atmosphere that would lend itself to a comforting environment that was not so much like a medical test.
When patients come into the room, they're able to select what theme they want through the Philips ambient lighting experience, and I think that gives them a little bit of control back, because when they come in here, it's kind of the unknown for them.
The ambient experience has improved our experience in the lab and has a calming effect on the patients, staff, and doctors, and that's actually improved the outcome, whether consciously or subconsciously, in terms of our patient care. One of the measures we measure in the hospital in terms of outcome is really the satisfactory score for the patients, because all our patients, they get calls next day or a few days later after the procedure, and we ask them what is their experience, and we have been having a positive response from our patients.
Well, before Ambient Experience, I remember many times bringing patients out of the machine and they would say to me, "I'm never doing that again." I've heard that many times over the years. And now I don't hear that anymore with Ambient Experience. I've never had a patient say to me, "I'm never doing that again." We're not spending that extra time holding their hand, bringing them in and out of the scanner, allowing them to get up and go to the bathroom because they have anxiety and they just need to get away. Those are things that can really eat up a lot of time. And so now I feel that the patients just lay on the table and stay there and relax. And so our throughput is a lot better because of that.
I think this Ambient Experience provides just another connection to patients. And right now in the radiation oncology world, patient experience, patient satisfaction is really what drives our patients to your hospital from the one next door.
So what I've heard from my staff about their experience in the new room is they absolutely prefer working in that room compared to our older lab. But the whole workflow for them, it fits their needs. And so when we were looking at the ambient experience and going that route, our staff was involved in, what are the challenges that you have day to day in caring for patients and what could make it better? And so those things that they talked about was part of that package. So for them, it's almost like a dream come true for them to work there. Their ease of practice is better. They can care for the patient better. And in return to the patient being more comfortable with the experience, it makes them more comfortable as well, which just makes them better caregivers.